and you come home and you're like, I smoked pot for like 5 days straight and drank for 10 days straight, and I found out I'm 4 weeks pregnant, my baby's gonna be like dumb. Hi, everybody. Welcome to another episode of Truth and Tonic for Women. I'm Dr. Traci, and I'm here with Tiff.
Hi.
How you doing?
I'm good. How are you?
How was your day?
It was fabulous.
What you do?
Yeah. Well, worked, waiting, counting down till the end of school, till summertime.
Oh, summer vacation.
Yeah. It's so weird to me, working after being home for 20 years as a stay-at-home mom, going back to work, but I love it. And so, but one of the best things about it is I get the summers off.
Cool.
So
I
it's
mean,
nice.
Guys, today we're going to make it make sense about pregnancy 101, though. We're not delving into anything crazy. We're going to have episodes coming up that delve a little bit deeper into things. Trimesters, each trimester, postpartum depression. We're going to do all the things. If you know anybody that needs a maternity consultant, bing, I'm your girl. But anyway, just want to do an overreaching thing about pregnancy, right? It's huge. I feel like it's a lot different from back in the day when everybody wanted to graduate high school, go to college, get a missus, which is a MRS degree, have a family. People are going out, getting careers, figuring out, do I want kids?
Traveling, doing their thing.
Right?
Yeah.
Can I just be an aunt? Can I be like...
Can I be a single mom? Can
a godparent?
Yeah.
Like the whole 9 yards. So all those things are on the table today. And like I said, email us and let us know what you want to hear about. Let us know how we're doing. And at some point we will be having people call in so we can take questions, and
we got to get the hang of this first.
Answer all the questions because this is all so new. But anyway, I hope you guys are enjoying what we're putting out. It's a community. It's a tribe. It's about women. It's about wellness. We want you to be the best you can be. We want you to love your skin that you're in, and we want you to help other people along the way.
Sure.
That's the only way that you can,
pass the word along.
Exactly.
Make it make sense.
Make it make sense. And we certainly don't want to leave anybody behind. So no woman behind. So pregnancy. What do you think about pregnancy? When I say pregnancy, what do you think of?
I loved it.
What did you love about it?
I loved everything. I've done it 3 times.
Did you like the sex before the pregnancy?
Well, probably. It's been a while.
Asking for a friend.
Yes, for sure. But I think just the whole, and I think I am a little bit rare in the fact that I loved being pregnant all 3 times. My pregnancies were so easy. I mean, no morning sickness, no crazy cravings. I mean, I did have
for Chick-fil-A every day.
I did when I was pregnant with Sophia. I had Chick-fil-A every day, and now she loves Chick-fil-A. Honestly, she does. It's crazy.
Yeah, I know. We bonded.
I know you did bond, but I just felt great. I felt like I looked great. Just in general, just knowing what was going on with my body. Now, I mean, it was a little freaky the first time, and there's always a worry associated with it. I mean, you always have, anything could come up, but overall, I felt good. My first pregnancy, I had a full-time job. I worked up until literally 2 days before she was born. And then I became a stay-at-home mom. So my second pregnancy, I had a 2.5-year-old. So that was a little challenging.
Yeah.
But I still felt good, but I was able to nap. So I napped. Yes. So I didn't so much with the first one, but I was able to nap more with the second one because she would nap during the day. So I would It was summer, dead summer, and I would crank that AC low and lay down, and I felt really refreshed. I remember like feeling really good, and tried to take care of myself. The second one, I was 40. I'm sorry, the third one, I was 40. So things looked a little different, not physically for me. I didn't feel any different. My pregnancy was just the same, but things looked different as far as doctors and tests and just things I had to do. I had to pay more attention to.
Tiffany's talking about the fact that after you are 35,
35.
it is considered a geriatric pregnancy. So we do extra tests. We make sure everything.
Geriatric.
Yeah, I know. Isn't that crazy? Especially now that people are having kids at 50.
I think they say advanced paternal age.
Well, in the medical field. For those of you who do not know my background, so I'm a midwife. Delivered in New York, one of the New York hospitals for over 8 years. Many babies, many patients, lots of good times. And I can tell you that pregnancy is different in any stage of life. But yeah, definitely the older you get, the more tests you get. And I'm really not even sure. I remember patients coming in, 36, 37, pregnancy, maybe first time, maybe not first time. And we do genetic testing, and afraid because they would say to me, well, if you tell me, so the older you are, the higher are odds of you getting a baby that may have Down syndrome or just different abnormalities. Mm-hmm. I remember them saying to me, like, I don't know if I'm going to do something either way.
So do you want to hear my personal story?
Yeah.
So with Sophia, because I was advanced maternal age, I would see my regular OB, and then I would see
an MFM.
What is that? A neonatal?
It's a maternal fetal
specialist. Yes.
Maternal fetal medicine doctor.
Okay.
Which means they are double board certified, so they deal with mother and fetal.
Yes. And baby. So at 13 weeks, I believe, you have a blood test called an MSAFP. Is that right? No?
Yeah.
Is that right?
Yeah, you have the letters there. Between 11 and 14 weeks.
So I had this test. So apparently the higher the number, the more likely your child will have Down syndrome,
and likely. It is not a definitive test. It's a screening.
And that's what so my number with Sophia came back high. So they said, we want you to meet with the genetic specialist. So my husband and I met with the genetic specialist, and she threw a bunch of percentages and numbers. She was super sweet, super helpful. She said, do you want to have the
choriovilli testing? It goes in, it takes a piece of.
Yes. So we could do that. We do it in the office. Then we can know for sure. And like you said, a lot of people said, well, I don't know what I would do. And I said to them, I won't do anything any different. But she said that a lot of people that have children already at home prefer to be more prepared so they can prepare the children. Right. So I thought about it, and Kelly and I talked about it, and I said, well, it would be nice because our children were like 7 and 4. So they were pretty old enough to understand what was going on. So I said, it would be nice to be able to prepare them. So we made the appointment to do it. So, I'll let you talk about how all that takes place or what they actually do. But anyway, they said, sign this piece of paper, this could increase your risk for a miscarriage. And so I kept saying to the nurse, like, tell me those numbers again. What do you mean you increase like what percentage? And she was like, I can't remember the percentage. So I said, okay. And I said, but if I go home and I'm really still like all these things, like I wanted her to tell me that nothing was going to happen.
Right.
Well,
And she can't.
she can't tell me that.
No.
And I know that.
Yeah.
So I'm there. I'm all ready. Kelly's there. I'm nervous. I feel like I'm going to throw up. And they come in and I said, I need to talk to my husband for a minute. And they go, okay, that's fine. And they walk out and I looked at him and I go, I can't do this.
Yeah.
I can't. I can't because she can't tell me that nothing will happen to my baby. And I can't because even if this test comes back and there is something wrong, I'm not going to do anything about it. I'm going to have a baby with Down syndrome.
Yeah.
Or a baby with whatever it is.
Trisomy, all the things.
All that. Yeah. And so I think that for me, it was just a no-go.
Yeah.
And it's not like that for everybody.
It's not.
I know a lot of people that have had them.
I can tell you most. So I worked in New York. I had a very vast group of patients that covered all ethnicities, nationalities, Jewish patients. They don't care. Catholic patients, they don't. You're not going to do anything about it. So what are we doing?
Yeah.
And it's very scary, and we do it to everybody. I mean, it's not like a nice fix, but there are some people who like the plan. Like, it's your first baby and you're 45 and I want this baby and I want it to be healthy and all the things. So it's a real fear. It's a great screening tool. And those are some of the things that, you need to be aware of. But
you can't
harping on now, in this day and age, do you get it done? There's nothing you can do about it now.
No. And when I was going to get it done, and I don't know if they do this now, but when I was going to get it done, they asked me to be part of a research project where they drew my blood and, I guess they would compare it to my test. And because they were trying to come up with a way to be able to do this test with the accuracy from a simple blood draw. Mm-hmm. So I don't know if that's a thing, if it's still in the works. I mean, it's been 14 years.
Yeah.
So of course I said yes, because my hope was that no woman would have to sit on the table and be as scared as I was.
Yeah. So basically this test that, you can still do, they take a needle. It's a very long needle. It has to go through your umbilical cord, your belly button, basically into the sac. And Tiffany said earlier that I have to go home and not, move. It's because we're puncturing this sac that's like keeping your baby safe and sound and alive. We want that to seal back up, but it goes in, it takes a sampling of the cord, and voila, you figure out what's going on with baby.
Yeah. So that's not low level stuff, but not low level. We digress.
Yes.
But it was part of my story.
Yeah.
And I'm sure that it's probably happens a lot now, more often than not, because the age of women having children
has changed.
And they did tell me, the genetic specialist said, there's no rhyme or reason for this age. They just pick a number. Insurance companies just pick a number. And they say any woman over this age, this is a percentage.
Yeah.
Which is weird.
So you can be you start your period at 11, you can get pregnant all the way up until people have had babies at 55. There's such a different dynamic for each pregnancy. But I guess the things that we want to talk about today is how to have a healthy pregnancy if you want to, how to go about getting pregnant if you want to, how to stay away from getting pregnant if you want to. I mean, all those things are perfectly acceptable. So I'd like to say that pregnancy is a condition. It's not a disease. Because a lot of people think that when you're pregnant, oh, God forbid, you can't exercise, you can't do this, you can't do that. A lot of that stuff is not true. So if you come to me and you tell me you're pregnant, I don't care what age you are, I'm like, yeah, exercising is good. Sex, yes, you can have. different foods. Different foods are kind of tricky, right?
Yeah, I do remember.
So here's the thing. We tell you not to eat certain foods and not to empty the cat box. So
Yeah.
I don't know if anybody knows this, but when you have a cat and you have a litter box, that is not your job for the next 10 months. You don't want to go anywhere near that.
Yeah.
Just because of the toxins, cats, urine, feces, the whole 9 yards can cause you to get sick. They say the same thing with certain types of bacteria, right? So that's why we don't want you eating cold cuts. We don't want you eating sushi. We don't want
Honey.
honey. We don't want you to eat, medium rare steak.
Soft cheese. That's what
soft cheese. But within those things, everything has a caveat, right? So grinded beef is different from a steak, right? So if you like a medium rare steak, your steak is getting cooked on the inside, on the outside. There's no bacteria on the inside. You're pretty much in the clear. Now, I'm not going to say that if you're the one person that goes out there and has a medium rare steak and gets some kind of bacteria, you're going to not call me. You're going to email me and let me know about it. But I want everybody to use some kind of... Doctors are very strict, I feel like. As practitioners,
I think you have to cover.
We have to cover ourselves. But as women and pregnant women and daughters, mothers, life needs to be not that stringent, right?
Well, I think you're already stressed out enough, already worried enough when you're pregnant.
Right.
So I think if you kept it, I tried to keep it to... like I didn't do honey and I didn't have sushi and I didn't have a lot of caffeine, and I did have sandwiches. Like I had deli sandwiches and stuff.
Yeah, and see, doctors tell you not to eat.
And doctors tell you not to eat deli sandwiches. I did have cheese dip because it's Mexican and it's cheese dip, and that's soft cheese.
Well, you gotta
but you got to keep it in check. You got to
your cravings. But let's just say you just have to have common sense about pregnancy, right? So if you're thinking about getting pregnant, you go out and you have a vacation and you come home and you're like, I smoked pot for 5 days straight and drank for 10 days straight, and I found out I'm 4 weeks pregnant. My baby's going to be dumb. Not true, people. No. Not true.
Yeah.
Babies are resilient. You are living your life. Don't stress out about it. I'm not saying that some people don't have kids with issues, but it's more so genetics than what you did in that first 2 week period.
Otherwise, I feel like we would be our bodies would somehow clue us in.
Yeah.
If that, you know what I'm saying?
You have no idea how your body was made for birth in so many ways. So we're going to have episodes on first trimester, second trimester, third trimester, most importantly, postpartum and postpartum depression, which are huge issues that people usually don't talk about. But as far as getting there, you're going to have to let your body do what your body needs to do. So I like to say, and this is going to be very crass, and I don't want to offend anyone, but it's just my personal opinion. Not we. I lived in New York City. I worked at NYU Medical Center for many, many years, and I lived down the street. I would walk down the street and I would see crack and meth heads all the time. And NYU happens to be very close to Bellevue in New York, which is where most of, the medical dramas in New York are filmed. And we would hear stories all the time. You guys, people on crack, no place to live, not a care in the world, have babies like rabbits. Okay? What I'm saying to you is if you're at home and you're having sex with your husband for 3 months and you're not pregnant, it's because you're not carefree like the crackhead on the street, right? Stop stressing. Your body does not like stress. And when you try to tell your body what to do, I want to get pregnant this cycle, they're like, screw you. I don't want to do that.
Yeah.
I want to go drinking tomorrow with our friends at the bar, right? So
Stress plays a big factor.
stress is everything. Stress is the most important component of getting pregnant. So story after story, right? You try for 5 years, you've done all the fertility treatments, you've done all the IUIs, you've done all the transfers, nothing worked. You finally get that adoption news because now you've like transfer all your thoughts and stress and dreams over to this adoption. You get a baby
And you get pregnant.
and you're pregnant the next week. What does that say? Stress, people, stress. Calm yourselves. Give it over.
I think you have to also think about your situation that you're in and how you're feeling about your goals and, like you said, like stress. And we all know that there are a lot of people that struggle with infertility, and it's just on top of that, you're thinking this is something I should be able to do,
Right.
and so that's even more added stress.
Yeah.
So it's hard for me to speak on it because I literally, like, the wind blows.
Yeah.
And I could get pregnant. But I have very dear friends that have been the polar opposite. So not everybody's story is the same. And I feel like when I talk to other people that are pregnant or wanting to get pregnant, my biggest advice is always look at where you are. How do you feel?
And your options.
Oh, of course, your options. Yeah.
I mean, you can be pregnant with a surrogacy.
Oh, yeah.
You can be pregnant with the woman in whatever country having your baby. You can be pregnant in so many different ways. It doesn't need or have to be you carrying a baby.
No.
And I certainly understand. Listen, I have always wanted children. It hasn't happened for me. I would love to wake up one day and just be like spontaneously pregnant with twins. But the fact of the matter is we have different ways of being moms.
Sure.
So I think that I would love women to think about the reasons why they want to be pregnant, right? They want to nurture someone. They want to care for someone. They like want that what's that love? Unconditional love.
What is that love?
Yeah, what is that love? That unconditional love. There's so many different ways to do that. Like, some of us are going to be aunts. Some of us are going to be mothers. Some of us are going to adopt children. And guess what, people? It still makes you a mother. I know that I have met people in my lifetime that told me that adopted child is nothing like a genetic child, and I don't understand their love, because when you love somebody, it's usually unconditional.
But and talking about
Except for
pregnancy,
really bad boyfriends.
Talking about pregnancy, some people just don't want to be pregnant. They want to have a baby, and that's fine. And I think that's fine, because, or some people have been pregnant and had bad pregnancies. There's that. When you get sick all the time.
Pregnant, and there are complications. Pregnancy, I like to say, is a condition, but there are certain things that can happen. I've had people who've had postpartum hemorrhages, which means that after they have their baby, they bleed profusely and they need blood transfusions, and they're fine afterwards. But it's scary like being in a room by
if you
yourself,
hear
you
about
can't
that-
see your baby, your husband's over here and they're trying to like work on you. You're like, what just
you
happened?
have a friend that happened to, you might say, I don't want to have a baby.
Yeah.
I don't want to physically give
have a
birth,
baby.
which
Or
is fine.
see now I happen to love it, and I have to tell this little story as well. So I was a adjunct professor at NYU, and I taught nursing students. So we would be on the labor and delivery floor. And since I was also a midwife, I was able to allow them to come in on a weekend and watch me deliver. So they could not only see it from a nurse's standpoint, but from a provider standpoint. And I had this patient, I had this student come in one day. She was all excited, and I'm delivering this baby, and I'm like, blah, 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 having the time of my life because it's so fun to me. And she steps out for a little bit, and then she comes back in. And then when we left, I was like, how was it? And she goes, Professor Scott, it's so bloody. I was like, what? It's bloody? Like, I had no idea.
Yeah.
Because just something that I don't even pay attention to. It's like I see a vagina, I see a head, I see shoulders, and then I see a baby, and I'm like, that was awesome. And all she saw was blood.
Yeah, they asked me if I wanted a mirror to see when
And you said no.
I said, nope, I'm good.
Oh my God. I asked people if they want to pull the baby out. Like, you want to pull the baby out?
No.
Okay.
I said that would be your job. That's why you have those letters behind your name, not me. Not me.
So fun. But yeah, pregnancy is
So what would you say to
huge
somebody that came to you in their early 20s that said, Dr. Scott, I'm really thinking about getting pregnant. I'm in my right state of mind. I'm excited. What are some steps I should take? Or what are some things I should expect?
Well, first of all, if she told me she was in her right state of mind, I'd be like, she's crazy. Okay.
Or maybe not right state of mind, but maybe like prepared, maybe at the right place in her life.
This is where I want to be, and this is what I want. So what would I tell her? I would tell her to, of course, you got to go in, see your physician, pick one, especially these days with, see how you're covered with healthcare. Wow. I mean, it's a natural thing, of course, but now
because it's expensive to have a baby.
It's expensive. So you may, we want everyone to have a natural childbirth, but you might not even want a natural childbirth, which is vaginal birth. You may need a C-section or want a C-section. Maybe
Is that true that they'll give you a C-section if you ask for it?
Yes. Oh. So if you want a C-section, you don't want to labor, it's your choice. What also is a myth out there is everyone thinks that if they have one C-section that they can't go back and have a baby vaginally, which you can. But insurance is important because it is expensive. Some insurances don't cover everything. That means you're coming out of your pocket. You need a doctor that you can trust. And when I say a doctor you can trust, I mean, all of us as women, we have an innate sense of when things are going awry, right? Just because your best friend and your mother went to this physician doesn't mean that you have to. If you go see that physician and you don't feel like they're listening to you, that they're not explaining things to you, if you always feel like you leave wanting because you didn't get everything answered, switch to another doctor.
My first doctor I was not thrilled with, but I loved the midwife there, and we had asked her to deliver my first daughter, and she left the practice like a month before my first daughter was due, and I never felt great with him. Mm-hmm. So when I had it does make a difference. Because I was very nervous going into the hospital. Well, first it was my first baby, but second, I think I really had seen this doctor like twice. That was it. And he wasn't part of a big practice. So it wasn't like whoever's on call. It was like him. Well, he was out of town. His his on-call people didn't answer or didn't come or something. I don't even know what happened. They literally pulled a retired doctor out of the hallway that was there to deliver because it was time. So that was that part. That was the only part of that pregnancy or that I really caused me anxiety.
And that's the other thing. When you choose your physician, midwife, whatever you choose, realize that physicians, midwives are not on call 24/7 every single day, right? We might have a stint, it might be a day. So when you go and you're speaking to your physician, you need to speak to everybody in that practice because your doctor may be on vacation, sick, in a GYN case, like it's important to know everybody in that office, and you have the right to ask questions and get answers to those questions. So you have to be your own advocate into pregnancy.
You
really do. So I would say first, find a physician that you really like, that you feel like is answering your questions, and that's attentive to you as much as they can be, because everybody, I'm going to tell you how it works out. We have a 30-minute slot for new patients and we have a 15-minute slot for returning patients. And although it's not good to put out there and you don't want to hear it, that is at the end of the day what it turns out to be.
Yeah.
So you have a limited amount of time to learn a lot of information, especially when it's your first pregnancy.
I never felt so when I found the practice I was with for my second and third child, the doctor who I adored, I've told you about him, and I literally think he hung the moon. I really think he hung the moon, but I never felt rushed. I never felt that he didn't care. I never once felt like I left with unanswered questions. I mean, if I got to the lobby and I had a question, I would turn around and I would say, I have one more question. They were like, great, come on back. We're going to answer your next question. Or do you feel like, this is okay? Even going through all that with my numbers and stuff with Sophia, I always felt like they cared about me. And that's what made me really love everything about my deliveries. Right. And he delivered my second one, my doctor, which I was so excited about. Literally, he came walking in the door and I was like, oh my gosh.
Yeah.
And then another doctor from the same practice delivered my third. And he was equally as wonderful because he knew me. He came in, Sophia was born like quick, but
and that's another thing.
But it makes such a difference.
If you can go back to your same provider, if you loved him, go back.
Oh, yeah.
If you have to travel an hour extra,
I would have followed him to the end of the earth. I really would have.
That's important.
I think we changed insurance during, before my third child, we went through an insurance change, and I said, as long as I get to go to that practice, you can change all you want. Fine. But it was very important for me because how they made me feel. And that was so important. So you need to really feel comfortable.
Yeah.
And don't be afraid to say, I don't get that feeling from this particular doctor, and keep on looking, because ultimately they're there to take care of you.
Yeah.
And they also have that reassuring voice for you when you need it.
You want to know that your physician, your midwife, is an advocate for you, not just there to cattle you in because you're in the numbers, but that he remembers your name. He knows your husband's name. There's a rapport that you can have with anybody, even if you have 15 minutes to spend. So know that is your right as a patient to feel that way.
And a good doctor, even as many patients as they have, a good doctor is going to be outside that door looking at your chart for 2 minutes and knowing what to look for, and come in, and you're going to think they were having lunch with you in your kitchen or whatever.
So
it makes you feel really, really good.
Great healthcare is the first thing I would say. The second I would say is a support system. So many of us go into pregnancy with the person that you love, the person that you're married to. And I say the person that you love because, you know, you can have a significant other and never want to get married. But there are others that get pregnant. It's a surprise. And guess what? The guy is like, bye-bye, see you later. This is not for me. The second thing that you need in your life is a support system. And it doesn't have to be your mom and your dad. It needs to be people that you trust, that you
don't have to do it all alone.
All alone. Someone that you trust, someone that you know that you can talk to, someone that you know that you can unload on and won't judge you, but also be there. And those people are the ones that you can sit with and just stare at and watch a TV show, and you don't have to talk a lot. Like, there's not a lot of verbal sometimes.
You just need that.
You just have that thing. So finding that support, whether it's your clergy, your best friend, your sister, your family, your neighbors, your co-workers, you need a support system because it takes a village to raise an amazing young person, I think.
I mean, I felt like there were plenty of times when I called on people throughout my pregnancy, you know, maybe just a question here, a question there. But I don't think you should ever, I mean, I know there are people that do it alone and that's fine too, but it's important that you have that person. And if you don't have that person in your day-to-day life, find the right physician and make it so you feel good mentally in a good mental space about what you're going through, because I mean, it's not easy. It's, you know, you always need somebody
Need somebody to love. The other thing is being open, right? So I know a lot of people, they get pregnant and the minute they do, they're Googling, they're reading all the books, and they're like, you know, I can only have 8 ounces of water. I can only eat like 2 ounces of chicken cooked well done and blah, blah, blah. You guys, there's so many options out there. You cannot be pigeonholed, and you gotta use common sense, right? So let me just give you an example of the things that I hear. Someone comes in, they smoke 2 packs a day, because I smell it when they come in and they're like, oh my God, Dr. Traci, I can't even. I haven't had a cigarette. And blood pressure off the roof. Just a crazy person. And I'm like, can you please just have 2 cigarettes as opposed to like just being a crazy person right now? Like, yes, smoking cigarettes during your whole entire pregnancy, a pack a day, you're going to have a baby with a low birth weight. It is what it is. Going from a 2 pack a day smoker to a 2 cigarette a day smoker because you're having a baby to get you through the crazy parts of the day, completely acceptable. There are ways around most things in pregnancy. So don't think that pregnancy is a black or white. It's gray.
Yes.
We don't want you to do a lot of things. We would like you to do a lot of things differently, but we understand that life gets in the way.
But your body is built to have a baby.
Yeah.
You're made to have a baby.
Yeah. I mean, let me just say, and I know a lot of people listening to me may not agree with me. 3rd trimester, your baby is fully developed. What we're doing in 3rd trimester is putting on some weight. So when you tell me that you're 40 weeks and you're stressed out and you're pacing back and forth because you want this baby out of you now, which is what I get, go have a glass of wine and chill out because you're stressing me out. Baby's not coming out with you being that crazy right now. Relax. You're not doing anything to your baby. So what I'm saying is, ladies, there are grays. Pregnancy is a gray area.
People have been doing it for a long time.
A really long time. Like just having a baby and just keep going. Keep moving.
Yeah.
So we're not recreating the wheels. I think that people came up with a lot of things to help us have healthier babies. But listen, back in the day, your grandmas were drinking, smoking, and whatever else, and we came out just fine.
Yes, yes. My husband's mom used to tell me that she was, when she was pregnant with maybe her third, she'd sit and she'd have her ashtray on her belly.
Yeah.
While she was smoking a cigarette.
That's what they did.
But I think you have to think about it. Don't take everything to heart. Your body is made to have this baby, and your baby is going to get what it needs.
No.
Your baby is going to get what it needs.
Another story I have to say. Not that I'm out here telling you to do your diets while you're pregnancy, because I think that you should eat a balanced diet, whatever that is for you. But I have had several anorexic patients who we needed to put on internal feedings, right? Have a baby, and I see them run down the hall and say, Dr. Traci, my baby was 7 pounds. Don't take this the wrong way, people, but babies are parasites. They eat up everything they need, and they'll be like, I'm not leaving you anything. They take it all. They take all nutrients. They take it in. They love it. And they'll be like, thanks. What's coming next? So another one of those things. Of course, we don't want you to be anorexic, but babies usually get what they need. So
don't not eat.
But it's like, pregnancy should be fun.
Yes.
Not stressful. Stress is the worst thing that you can do. I was stressed
a little bit, but I think for the most part, my pregnancies were fun. My pregnancies were just, great. I did say when I was 40 and pregnant that I was going to step it up a notch and went to some, more expensive maternity clothes places. I was like, if I'm 40 and pregnant, I'm going to look good. And I felt great.
Well, and there is a whole sexual component to this, because first trimester, third trimester, people are coming off the walls. But I do have those fathers that come in and they're like, how can I make this baby come faster? It's like 40 weeks and blah, blah, blah. And I'm like, you can have sex. What? But my penis will hit the baby's head. Like, I can't do that. I'm like, listen, that's a stretch. You're not going that deep, first of all. And second of all,
don't brag.
Your sperm is literally softening your cervix. It's the best thing that you can do. But these are the same people
that mamas
after they have a baby, when we don't want you to have sex for like 2 weeks. They're like, but what do you mean I can't have sex? Like, come on, dude. You're worried that you're going to hit the baby's head because we're so endowed.
Yeah.
I had to draw a couple of photographs or a couple of pictures from some people so they could understand that ain't happening. That's not happening.
No.
But yeah, after birth, men, leave your women alone. A whole baby came out of that. Walk away. Hands.
Walk away.
Hands. You have hands.
Walk away.
You have hands.
Walk away.
You don't want any of it.
Right. But I guess there's just, like you said earlier, there's so many different ways. There's people, the over preparers, the under preparers, the people that want babies, the people who don't want babies. But all in all, I think for you to have a healthy baby, you need to be healthy. And I think for your mental health, you need to be healthy, and you need to surround yourself with the knowledge, because knowledge is power. And, my pediatrician, after Olivia was like 8 months old, and I had been there 5,000 times, every time she, got a cold or something. And she said, I know what you're doing. And I said, what am I doing? And she said, you're Googling. Like, it's not, there's not a doctor in there. Type in. She's like,
it's not good.
Quit.
Googling is not your friend.
Googling is not your friend. But I think all in all, pregnancies, you have to you have to think
They're
about,
individual.
yes, they're very individual. Just like,
And they should be stress-free. It should be the best time of your life.
yes, yes. And, you know, it's not for everybody. It's not always stress-free. But I think that if I could give advice, it would be to try to find your happy place.
Yeah.
At some point during the day when you're pregnant and look at how amazing it is and what your body is actually doing. You are creating and carrying another human.
Yeah.
I mean, that in itself is
incredible.
Yeah, it's incredible. It is. And
especially when you have a girl.
But, you know, being just a female and knowing what your body can do, and then preparing your mind and getting yourself into a place where you just let your body do what it's supposed to do.
And guys, it does everything
right
it's supposed to do.
It does. It does what it's supposed to do.
It is a miracle upon miracle. I have been blessed so many times to like witness it and help facilitate. I know patients would say all the time, "Thanks so much for delivering my baby." And I'm like, "You delivered it. I catched it." Yeah, or catched it. I caught it. But you know, we're the physicians, the midwives, we're there to catch the babies. We don't do anything. We help you
do what your body does anyway,
naturally. And you know, there's
so it's not because you can't stop it.
Yeah. Once
when you go into labor, you can't.
It's there. It's,
you know, you think like people have probably said, "I don't want to do this anymore. Stop this. I don't want to have this baby."
And what I say is, "Okay,
okay, too bad. Okay. So let's take a deep breath."
Okay. Oh, baby's here.
Yes.
You just don't even think about it.
Yeah.
But yeah.
And birth, even delivery looks different. Pregnancy looks different for everybody. Deliveries look different for everybody. So please don't ever compare what somebody else had to what you have or might have. And if you hear, you know, there are some you know, stories that are not great endings, and it's not always like that, and it's not always going to be like that. So
but that's life.
But it is life. But don't be that. Try not to be that person that says, "Well, this happened to so and so. Well, that happened to so and so," because what's going to happen to you is so different. You know, when I tell people that my 3 pregnancies were amazing, were like carefree, you know, I did, you know, besides the little hiccup with the doctor, and then, you know, my test with Sophia, and I did get dehydrated when I was pregnant with Sophia, and it caused contractions, which I didn't know. And I spent the night in the hospital getting hydrated, and I thought I was going into early labor. And so we went to the hospital. And it was in the middle of the night, so I was so tired. They hooked fluids up. They said, "We're going to run some tests." I woke up like 8 hours later, and she's like, "You've had 2 bags of fluid. You were dehydrated." And then the one time when Olivia was little and she came running and jumped in my lap, and I was pregnant, and I thought my water broke and went to the hospital, and I peed on myself. So that was great.
That's not that.
But really, all in all, is just remember that your body's doing what it's supposed to be doing, and no pregnancies are alike. No deliveries are alike. So don't set your expectations up, or don't change what you want to do because of somebody else.
Tiffany asked me the things that I would do, and I would coach someone on. I know this is going to hurt so many feelings out there. But everyone who's coming to the hospital with a birthing plan, please leave your birthing plan at home, because you know what? You know who controls your birth? Your baby.
Your baby.
Your baby doesn't care what you want. Doesn't care if you want a vaginal. He might not want one. He doesn't care if you want a C-section. You might come in and deliver full term. Like, leave the planning at home. It's God's gift, basically. Being pregnant, God's gift. Let it happen. the way it's going to happen. Sure, you want some things to happen the way you want it to, but to come in with a list of this is what I want, don't say this word. I want a dark room. How can I deliver you in a dark room? Like, I need some light.
You know, a lot of people like to labor at home. A lot of people do. Me, man, that first contraction, you know where I was? Hospital. And my husband said, well, the doctor said maybe you should take a warm shower. No, I'm not taking a warm shower here.
Well, especially after your second and
I'm
third.
going to the hospital right now.
But yeah.
But a lot of people, I think that I love the fact that some people can stay at home. I think it's great, but I wanted to be I wanted to be in that bed.
I want to know
doctor's near
that I'm good. But yeah, you guys.
So everything's different. Everybody's different.
You're good. We'll take care of you. Because we talked about earlier that you need that physician that you trust. Trust them. You're good. You're in good hands.
Yeah.
And I hope today that we made it make sense. And as always, please email us and let us know what you want to talk about. Thank you for watching Truth and Tonic for Women. If you have any questions, leave a comment and let us know. Also, follow us on social media to interact with the community. Like, comment, subscribe. I'll see you in the next video.